Cambridgeshire. So it's just gone 10 past in fact. My name's Oscar. Let's have a big conversation this afternoon. Lyme is a word, not a sentence, and we're going to talk about Lyme disease. What is it? Well, most of us know it's spread by tick bites, but that's as far as our understanding and certainly experience stretches. We could guess, I suppose, the number of cases across Cambridgeshire and indeed the UK are low, in the hundreds or thousands a year, certainly not more than that. So from campaigners, from doctors, from sufferers, we can learn lots. Let's welcome first Demetrios Loukas, teacher campaigner. He's been working in Cambridgeshire, I know, Oxfordshire, and he's based in London. Demetrios, hello. Where are you at the moment, Demetrios?
Hello there. Thank you very much for having us on your show. I'm in Southeast London.
In London.
I'm in Southeast London. Yes.
All right. Also on the line with us, Dr. Chris Newton. Hi, Dr. Newton. Tell us a bit about your work.
Well, we got involved after a meeting in Houses of Parliament. Demetrios organised a meeting, and we basically presented our work and with PHE. So PHE were there to sort of moderate what we were actually saying. Our view was slightly different to what PHE was saying. You mentioned in the thousands. I would take issue with that. I think it's a little bit more. I think we're looking at, we had a survey, we put together a survey a little while ago, and it looks as if we're in the tens of thousands at least. Cases. So this is why we have a slight dispute with PHE or UK Health Protection Agency, whatever they're called now.
And PHE being Public Health England, yes.
Yes,
well, look,
indeed.
I'll come back to you, Dr. Newton. That's very, very interesting and helpful background for us. Let me introduce a couple of other guests we have on the line with us. Dr. Armin Schwarzbach, Medical Director, doctor, therapist, specialist of laboratory medicine, joins us from Augsburg near Munich. Afternoon, Doctor. Is the sun shining in Augsburg today?
Yes, good afternoon. It's not snowy. We have nice weather, but we have still ticks here in Bavaria, where I live.
Also with us, Richard Brooke-Powell, who lives in Royston with first-hand experience of Lyme disease, I think, Richard. Is that right? Good afternoon.
Good afternoon, Oscar. It certainly is sunny here, anyway.
Now, Richard, maybe you can tell us about your experience. We'll start at the beginning, as it were, with a word on what Lyme disease is. I mean, how would you define it for those of us who couldn't tell you much about it, Richard?
Lyme disease, as far as I'm concerned, is a disease that nobody seems to know anything about. It shows multiple signs and symptoms, and anybody can be brought down with it without them knowing what it's all about. It's very debilitating, and if you don't get it treated immediately, which is one of the problems with it, it's not being recognized enough, it can really turn into a very chronic disease, which makes you really, really bad. It's not easy to treat at all.
And you're speaking with experience?
I am. I've had it for 40 years.
40?
Yeah. I was bitten by a tick, and I didn't know anything about ticks or Lyme disease or anything. And I spent 3-4 days in bed with fever and high temperature and just feeling really ill. Went back to work, and I was working on a golf course at the time, and I had to literally sit down on the golf course and recover every so often throughout the day. Some days I'd get through the whole day, some days I couldn't. It just sapped every bit of energy out of me. It gives you terrible headaches, muscle fascinations. They vibrate, they twitch, you feel stuff crawling underneath your skin. It really affects every single part of your body.
So, Demetrios, listening to Richard there, nobody knows much about this disease. You've been campaigning then for what? Greater awareness, more support on the NHS, better research? Tell us in your words.
Oh my, there's just so much to cover. Like Richard, I was bitten back in 2005 when I was training to be a primary school teacher in Oxfordshire, and we visited a farm, and that's where the bite happened for me. I developed fever and a rash, which is what is clinically known as an erythema migrans. And the following day, I presented to my GP, and he basically prescribed an antifungal, the wrong medication, no antibiotics. He clearly didn't suspect Lyme disease. I recall noticing the bite on the back of my calf later on, because it's not like a mosquito bite where you get an itch or the need to itch it. I didn't experience that, but I did later on see the bite and thought, oh, what's this? It looked very more like a bruise with a puncture point, a bloody puncture point. So there is a lack of awareness among GPs and clinicians, so that's a concern. And then I had a major surgery. I developed a heart arrhythmia. That was awful, because my GP couldn't understand why I had developed a heart arrhythmia, literally instantaneously, unprovoked. So I had a BPM of 33 at night and 42 during the daytime, and that baffled the cardiologist. But I eventually came across a cardiologist at King's who clinically diagnosed me. And what was interesting is that he prepared me, because he said, look, the tests that the NHS use are not totally reliable, and there are other tests available in Germany and America. And I decided, to cut a long story short, I was referred to the laboratory in Germany, which is where Dr. Schwarzbach is, and where they carry out T-cell tests. Now, the T-cell test the results showed Lyme disease, whereas the NHS ELISA, C6 and Western blot did not. But despite the cardiologist supporting these results, infectious disease doctors from 4 different trusts, we're talking about 4 different trusts, all dismissed these T-cell tests. Now, it's inconsistent, because T-cell tests are used to diagnose tuberculosis, and I'm sure Dr. Schwarzbach will go into greater detail, as well as more recently coronavirus. So if it's acceptable for T-cell tests to be seen as evidence, of infection for those conditions, why is it not acceptable for Lyme disease? So we need the T-cell test to be validated and acknowledged, so that improved diagnosis is offered to the public.
Right. So just on that then, Dr. Schwarzbach, tell us about your research then. Maybe you can advise if what's being prescribed, if what's being offered as treatment in the UK and Germany at the moment, the tests as well for Lyme disease, is it appropriate? Does it work?
Tests are not so easy for Borrelia burgdorferi, is the bacteria behind Lyme disease. And it's a very complex bacteria, more complex than, as an example, SARS-CoV-2. The ELISA, which Demetrios mentioned, has huge problems in sensitivity, so a lot of false negative results, and the doctors believe in the ELISA, but they are not the best test systems. We have a Western blot which is more sensitive, but this is not done in the beginning. You do first the ELISA test and then the Western blot as a confirmation test, but it's the confirmation test. Western blot is more sensitive than the ELISA test. So we have a complexity. It's a great imitator, let its name this way. A great imitator of symptoms we have heard, and also diagnostic tests and also of therapies. This means patients are misdiagnosed because doctors exclude Lyme disease because ELISA is false negative. And what we have forgotten in the laboratory medicine, what Demetrios mentioned, are the T-cell tests. They became famous also for SARS-CoV-2 now. So we check the cellular immune system for immune responses against Borrelia burgdorferi, the pathogen for Lyme disease. And these tests are 20 to 200-fold more sensitive than any antibody test. So why should we not improve diagnostic tests also in England and other countries in the world? And we try that doing in Germany. And I think, therefore, we can diagnose better Lyme disease than in other countries in the world.
Well, look, let me put that to Dr. Newton then. In your view, Dr. Newton, in your experience, in your campaign, what needs to change?
Well, initially, my view was we should look for a direct test. So we should try and look for the organism itself. At the moment, what it is, it's like looking for an echo. So you're looking at the impact that the organism has on the immune system. And testing at the moment is looking for antibodies to certain proteins on the organism's outer coat. The test that Dr. Schwarzbach uses is a T-cell test, as Demetrios has said. The problem may be with it's a little bit pragmatic from a pragmatic point of view, is that it's technically quite challenging to run. I think this is why the UK Health Security Agency, or old Public Health England, has avoided it. I've had many discussions with people at UK HSA. They basically say, well, it's not specific enough. Well, they sort of come back and say, well, hang on a minute, let's do the research. And this is what's lacking. They say, well, people, control samples that haven't got or clinically haven't got Borrelia or infection or Lyme disease will test positive. I say, well, let's do it. Let's get the money. Let's do the research. Technically, as I say, it's more challenging, but I think it will give a much better answer than we have at the moment with the current testing regime.
That's interesting. Richard, back to you. What's it like then, living in Cambridge with this disease? I mean, I think you had to stop working full-time, and you've described the exhaustion already and the illness. I mean, do you have good days? Can you feel healthy, Richard?
Yes, I can actually. There are days I can quite, get on very well and manage the whole day. But there are other days that I'm literally just out flat, and it just takes every bit of energy to just get up and do something. It messes with your energy levels, which are really the problem for me. Sorry, I've got a cold at the moment, which doesn't help.
It never does.
So it doesn't matter what you try and do with Lyme.
Yeah.
You run up against these brick walls. Some days I had headaches for 20 years, literally from morn till night. They never went away. I had muscle fatigue, which is I now get cramps, terrible cramps. Just out of the blue, they just come on. It affects every part of you, and you never quite know where it's going to crop up next. That's the trouble.
And we wish you all the very best with it, Richard. Yes, go on.
Sorry, they're getting misdiagnosed a huge amount. Because the teaching isn't there, the education isn't there for the doctors.
Well, and I hope conversations like these can go some way to help. We've learnt lots and lots this afternoon, all thanks to you. I'm going to say thanks to Richard Brooks-Powell in Royston, Dr. Armin Schwarzbach in Germany, Dr. Chris Newton as well, and to Demetrios, who we should give the last word to here, Demetrios, because I've got a short clip of a song, something your team worked on to raise awareness. Is that right?
Yes, that's right. It's an Anglo-American collaboration. It's just another method of raising awareness, and I'm very, very grateful to Trayvon Sambers-Moore and Malik Curtis and Adam Law over in the States, who gave their time and energy and to create something that is listenable and positive, uplifting. It's just another method of getting the message out there, and I'm very grateful to you for playing a clip. Thank you.
give in. Head up when you're feeling low. Everybody goes through life, so don't give in. Like you will win. The doctor took the time. Maybe there was something not right. It's a bad place when you're half awake. No one listens or calls. No one ever listens. Before
The sound of Cambridgeshire.
And all the music you love. BBC Radio Cambridgeshire.
Well, my sincere